The cross-bracing protocol is a method by which you can brace the knee up at a 90-degree angle, like the edge of a square type angle, for an extended period of time. That's about 4 weeks. The patients from there can then slowly straighten their knee out. That is a protocol that does need to involve a medical doctor, because there is a significant risk of getting a blood clot. And so you need to be on blood thinners, and you need to fit the inclusion criteria to be a part of that. So that's a specific protocol. My personal protocol is one that involves weight bearing and an extension block. So it's less aggressive. The patients can have their knee bent to about negative 30 degrees, and they have that for around 6 weeks. There's no mandatory blood thinning required, and they're able to bend their knee as much as they feel comfortable, and they can kind of weight bear as tolerated, just avoiding twisting, changing direction. And once that 6 weeks is done, they can kind of move from, they can either wean off the brace completely, or they can keep the brace hinges on just at the sides, and then again do a follow-up MRI at 3 months. There's some patients who either can't get a brace or don't want to get a brace, or you might see them at 5 or 6 weeks post-injury and they've started rehabilitating. I've got one at the moment who's a semi-professional rugby player here in Perth, and he just couldn't get in to see me. And we were chatting, and he started his own gym and rehabilitation program anyway. And so we just made some modifications to that and then started supervising him. And so that's something you can also do. And then if the intention is to go back to sport and they're young, active, or pediatric, certainly I would recommend us rescanning them to see if there's been ligament reattachment, and then checking to see if that ligament is functioning, because obviously there's also, when it comes to the quality of the ligament, we want it to feel as if it's stabilized, but in non-weight bearing ideally, and certainly in weight bearing the patient should have a stable knee and have no sensations that it's going to give way. And so those are the general protocols if you're looking to not have surgery and do a scientific rehab program or bracing program. Those would be your key options. And so I've had pretty good success looking at those and using those when the patients have it presented to them. G'day, it's Dr. Kieran Richardson, specialist physiotherapist and the director of Global Specialist Physiotherapy. I'm very excited to be speaking to Brad Beer from Pogo Physiotherapy on the Physical Performance Podcast.